All right, welcome back again. My name is Dr. Andrew Gorecki, physical therapist, back pain expert, and hopefully in this module you'll walk away with a better understanding of the true causes of back pain. Remember, the causes are different than the types. The types are usually based on the structure, the structural changes that may have been identified on an image, but they do not give us enough information as to what's causing the pain to actually happen. Because remember, a lot of people with those types of back pain that have been identified on an image may have pain and may not have pain. In fact, the majority don't have pain. So that cannot be the cause. If it was the cause, then every single person, for example, that has stenosis or aka degenerative disc disease would have pain when they're giving an image that shows that they have degenerative disc disease. Just like a disc bulge. If disc bulges caused pain, then every time somebody has one on an image, it would be the cause of pain. There'd be pain associated, and we know that's just not the case. So hopefully you're able to wrap your head around that concept. That was a hard one for me, but again, if you can wrap your head around that, then you can move on to, well, what's really going on then that's causing my back to hurt? So what are the true causes of pain? There are many. And we're going to simplify that down to really three areas of the body that are most commonly. So again, the 80-20 rule. So 80% of the time, it's only 20% of the possibilities. And so we're going to cover those 20% of the possibilities in this module. But really, we could actually narrow it down to one cause, which is my body's not moving properly. Therefore, it's causing my lower back to move more than it's designed to move. So again, you should now know that what it's designed to do, what it is able to do, and then know that if it gets asked or demanded to do more than what it's designed to do, we're going to have tissue breakdown, which then triggers the healing process, which part of that healing process is inflammation, and then you're going to get pain. So let's dive in. The true causes of back pain. Well, the simplest answer is it's in the surrounding areas. The body moves together as one connected unit. So the song that I'm teaching my 4.5-year-old, the foot bone is connected to the knee bone's connected to the hip bone's connected to the backbone. It truly is, when I'm moving my head left and right, when I'm standing, there's motion happening all the way down in my feet. The body moves together. Nothing moves in isolation. And that definitely stands true for the lower back. The foot moves the knee moves the hip moves the spine. We'll call that chain reaction biomechanics. And we'll give credit to the source of that, which is the Gray Institute. Dr. Gary Gray has been teaching for 35 years chain reaction biomechanics. That's what we're going off of today. If the back moves beyond its limit, and every joint and every tissue and everything, nerve, tendon, ligament, muscle, has a limit in the body, and the back is no different. If the back moves beyond its limit, then damage will occur to those soft tissues. Just like if you take a bone beyond its limit, it will break the bone. So again, the back is designed, let's talk about that first. This is a pretty exciting topic. The back is designed to move forward and back, to move side to side, left side, right side bending, and it's designed to rotate to the left and rotate to the right. Now, every one of those motions has a limit in what it can do biomechanically. And usually when an area of the body has a lot of motion in a certain direction, that means typically it likes to do a lot of that. It has no problem with that usually. But when it has little motion, a very small amount of motion available before it reaches its limit, that usually means it doesn't like to do that very much. So let's talk about the lower back. And let's start with the thing that it likes to do the least, which is turning. And if you're out there with back pain, which most of you are listening have back pain, right? You know that it doesn't usually feel very good to twist, right? To turn the back. Well, the lower back is only designed to rotate Each segment can only rotate 5 degrees. That is not very much motion. I mean, when you stand up and you turn, I can turn my head and look all the way behind me, at least 180 degrees. My lower back only does 5 degrees of that. And so it doesn't really like to do very much of that. It doesn't have the capacity to do very much of that. Good thing that the areas below the hips, ball and socket joint, and the areas above have a lot of rotation available. They should at least have a lot of rotation. They're designed to rotate a lot. And so think of the areas above and below as it relates to rotation as the lower back's best friend. So again, the lower back only rotates 5 degrees before it reaches its limit. Looking at forward bending, okay? So the lower back can forward bend 40 degrees. So it's got a significantly more amount, and that's actually the thing that it does the most, which is bending forward. However, if you think about it, going from a standing position and bending all the way down where you can touch the ground or your toes, that's a lot more motion than 40 degrees, right? In fact, we might say that that's actually like 3 times more motion than 40 degrees. And so again, your lower back is going to rely on the areas above and below to move to do 2/3 of that motion of bending all the way forward. Otherwise, you're going to make your lower back bend more than what it's designed to bend. Now, looking at the motion backwards bending, so going from standing up to leaning back, the lower back can backwards bend 30 degrees. So that's nice. And then finally, from left side to right side bending, the lower back has 40 degrees of side to side motion to give. And again, these are total motions, right? So you can tell it hates to rotate. It loves to bend forward. It can extend back, and it can side bend side to side. So that's what it's designed to do. Now imagine if you took your finger and you extended your finger back. You have a degree of extension of your finger that isn't a problem, but if you take it beyond its limit, you can imagine pain, swelling, inflammation, damage start to occur because you take it beyond its threshold. That's what we're trying to identify with back pain is why is the back being taken beyond its threshold? It's doing something that it doesn't like to do. It doesn't just wake up in the morning and decide to be damaged and to trigger the healing process, which is inflammation. So we know that the first area we should look are in the hips because the hips are a ball and socket, and the hips are designed to move a ton. Specifically with rotation, each hip is designed to rotate 60 degrees. So compare that to the 5 degrees that the lower back rotates, and then you realize that the hips are actually designed to help the lower back and provide way more motion than we know to be true. So in total, the hips can rotate 90 degrees. They can bend forward 125 degrees. That's great because the lower back can only bend forward 40 degrees. We know that they can move side to side 90 degrees and they can extend back 15 degrees. So in this case, the lower back actually has more backward bending or extension than the hips, but it has 30 degrees. But combined, you've got now a total of 45 degrees that the body can bend backwards. So in that scenario, the hips definitely help out the lower back. So the hips basically do what the back can't do. But oftentimes the hips don't move well. And they don't move well because most people don't have strategies on how to keep their hips healthy and mobile. And because the average person is sitting on their hips 10 hours a day. And so when you're sitting on your hips 10 hours a day, like we're doing right now, the hips aren't moving. And if we don't move it, we lose it. So the body will not just keep motion around if it's not being asked to use it. That's just the way the body works. So the hips become the number one problem or the number one cause or the number one opportunity when we're trying to help someone with back pain. And that's a great strategy because if you're out there listening and if you're like I was struggling with back pain, if I have a strategy that asks you to move your back more, whether that's stretching or strengthening or massage or manipulating through manual therapy, chiropractic adjustments, If my back hurts and you're asking me to move it more, there's a good chance that that's going to make it hurt more. And that's a sign that it's a movement problem, but we need the body to heal itself naturally. So we have to reduce the motion in the lower back naturally by improving the motion in the hips. Now, the challenge actually becomes that the hips, remember back here, the hips have all these motions, so they can move, they can rotate left and right, they can bend forward and back, and they can move side to side, just like the lower back. They're designed to move in 3 dimensions. However, you've got 2 hip joints and 6 motions. So the possibilities really become 12 motions that can be problematic or limited. And that's only talking about the motion. That's not even talking about the fact that they also need to be strong so that they can control the motion. So the hips are the region. Now, the way to identify which motion, which direction, and whether it was strength or flexibility is the problem, that becomes the complicated part, which we'll attempt to get to as we move forward in this course. So lots to look forward to there. So next up is the upper spine. So the upper spine is an area that as you move up the spine, every segment is able to move more and more and more. And you think about, by the time you get to your neck has a lot more mobility than your lower back does. And so the upper spine is designed to move more than the lower back. Again, as you move up, it's designed for more and more motion. We're talking about the upper spine. We're talking about the thoracic spine. So again, what is the upper spine designed to do? What can it give? Well, look at this. It can rotate 160 degrees. Wow, that's a heck of a lot more than 5 degrees like the lower back. It can bend forward 125, much more than the lower back. The lower back was at 40. It can move side to side or side bending 90 degrees, and then it can bend backwards 60 degrees. So now again, it's got way double the motion almost of the lower back, is ability to extend backwards. So it's designed to move a lot. And again, this is a really common area that doesn't move as much because of gravity and sitting 10 hours a day. And as you see somebody that gets kind of that hunched over kyphotic posture, they start to lose motion in the upper spine. Remember, the lower back can only rotate 5 degrees. The hips can do 90 and the upper back can do 160. If you take away the hips and the upper spine's ability to rotate, you can still turn the body, but the back has to do more. The lower back has to do more than it wants to do or is designed to do, which causes damage and then triggering the healing process. The same principle can be applied to all movement directions in the upper spine and the hips. And so there's a lot to look at there, but I want you to get the basic concepts of how vital the areas above and below are to the health and success of the lower back. You need the areas above and below the lower back to move properly without pain. Another common area, this is the third most common area that can cause back pain, is the foot and ankle complex. So mainly because the foot affects the hip. So when you're standing up and you move your hip, you cannot not move your foot. So they're linked together. The foot moves equally in directions equal to what the hips are doing. This is a great diagram to demonstrate how crucial it is for the foot and what its influence is on the entire body. And you can see the guy on the right, the green guy, is all aligned. His feet are aligned equally, his knees, hips, back, and etc. The guy on the left side, you can see he has a left foot that is a little flatter or pronated than the right foot. And you can see that when the left foot flattens out, it also makes the knee drive to the inside, which then drops the pelvis down, which then, if the human body was able to adjust, it would simply lean to the left. However, the eyes have a reflex in the body that want to keep the body nice and straight. So the body will overcompensate by leaning to the right, and you'll get this scoliotic curvature here. And so you're going to get compression. And in fact, on the right side in the lower back, you're going to have a hole that's closed down in these vertebrae. So that's going to cause some stenosis. And if you have stenosis already, it's going to be more likely to close the hole down. And on the left side, it's going to open the hole up. So you can see that we can focus on this person's hips or back or upper back the entire time. But if we're not looking at their foot and recognizing that they have one foot that's flatter than the other foot, we're going to miss the cause of back pain. So a nice illustration there. So, in fact, any area above or below the back can cause back pain if not moving properly. So an example could be a shoulder complex. If I have a stiff shoulder and I'm turning and reaching and lifting for things above my head, if my shoulder's not moving properly, I can still accomplish the task of reaching up to the shelf, but the rest of my body's going to move more. And so it's going to cause my lower back to move more than what it may be designed to move. So anywhere along the chain, it can be a problem. 80% of the time, it's the upper spine, the hips, and the foot and ankle. So again, we're going to use the 80-20 rule. It would be impossible for me to teach a course that gives you every single possibility in the entire body that, if not moving properly, can cause back pain. But we're going to hit it from the 80-20 rule. 80% of the time, we're going to look at the upper spine, the hips, and the foot and ankle, and we're going to find success. And so I look forward to giving you more of that information as we move forward, and you're doing a great job so far.